Diabetes and Social Security SSI. Let's talk about it. I made another video to let people know I can answer questions. I did get a few generic questions, a few specific questions. The bottom line is always going to be every case is different. I can't tell you 100% for sure who's going to get disability and who isn't, but just from my experience, I kind of know what types of cases can be worked to be made into approvals. So let me give you some advice if you've applied for Social Security or if you're about to apply. Make sure you list every single doctor you've seen in the last 5 years. Every hospital, every urgent care, every OB visit, everything. Make sure you put down for the date your disability began, think about when you became unable to work, because that's the date they're going to be using to determine how far back to pay you. And a lot of people don't realize that. It's just a one little line that says, when did you become disabled? But that date is very important. Now, if you worked after that date, they're not going to find you disabled as of that date, more than likely. Obviously, there's exceptions, but because you were able to work, so you're not disabled if you're able to work. They want to see current ongoing medical treatment. So if you're not getting it, you need to go ahead and find a community health center and talk to them about being seen. Usually they have programs for folks that don't have any income. If you have Medicaid, a lot of places take Medicaid. If you don't have Medicaid, I definitely recommend you apply for it. It's different in every state, so I can't give you a lot of information on Medicaid, but it would at least give you some medical coverage. If you are saying you have a medical condition that started on a certain date, like from a car accident, they're going to want those records. If you want to supply your medical records to Social Security at the time of your application, that will speed your case up, because that's a big part of the case, is them ordering your records. That being said, make sure that you keep copies of anything you give Social Security, because they're really good at losing things. Even when I worked for the attorneys, they would claim they didn't get things that I had a green card showing that they had signed for. So unfortunately, that's just the way it is. I guess it's because they have so many cases or so much going on. Another thing you need to look at is think about what things you can and can't do around the house when you're filling out the application. I know we want to talk about what we can do, but mainly focus on what you can't do, because that's what they're trying to figure out as far as determining if you are disabled. If you're able to return to work in a past job or any job that they feel you can do in the national economy, then they're going to deny you. So they send you a function report to fill out. Fill it out as if you're having your worst day. And don't lie. Obviously, we want you to tell the truth, but just make sure that you focus on what you can't do versus what you can do. Because they're going to pinpoint things you can do and to say you can return to work. If you have doctors willing to write letters on your behalf, I've treated this person for 20 years for these conditions with these medications. They're having these ongoing problems, and I don't think they can work because blah, blah, blah. If you have a cane or a walker, make sure your doctor has given you a prescription for this, and give that to Social Security, because that is another thing that's important. If you need something to ambulate, whether it's a cane or a walker or a crutch, anything to walk around, and it's medically necessary, meaning your doctor says you need it, then you need to get a prescription for that and give it to Social Security, because that also affects what type of work you can do, because now you're basically an armed person, or a no armed if you're using crutches. Some other things, if you have a mental condition that you're alleging, make sure you list all the medical treatment you've had for it, because they're looking for a history. They want to see you've been in the hospital, you've been to the urgent care, you've been to a therapist, you've been to a counselor, you've been to a psychiatrist. They want to know what medications you've been on. They want to see a long-term history, because if you're just diagnosed with something, what they're going to do is they're going to deny you and saying that you're probably going to improve with medication and therefore you won't be disabled. Because under the definition for disability is your condition has to last at least 12 months or expected to last at least 12 months or end in death. That's the abbreviated version. If you have a condition, for example, I had people apply because they were pregnant. You're not going to be found disabled for being pregnant, because nobody's pregnant for 12 months. That just doesn't happen. Excuse me. And obviously, whatever condition you have, you're going to want to talk to your doctor too and see what your doctor says if they think it's going to last a long time. Now, if you don't have a lot of medical records, Social Security is going to send you to their doctor. That's called a consultative exam. It can be for a general physical. It can be for a mental evaluation if you allege depression, anxiety, things like that. Sometimes they'll send you to an eye doctor if you're alleging vision loss, or they'll send you to a ear doctor to test your hearing. So sometimes they'll send you to specialists. A lot of times those visits take place in another doctor's office. Sometimes they take place in conference rooms, wherever the doctor has set up with Social Security. So don't let that throw you off. They just do that for convenience. But definitely if they schedule an appointment, make sure you keep it. Anytime you refuse to do anything Social Security asks you to do during the course of your case, they can close your file and say failure to cooperate and deny you. And it doesn't look good, especially if you end up going in front of a judge later. Now, if you get denied, you have 60 days from the date of the letter to appeal it. Usually, for an initial denial, at the top it'll say notice of disapproved claim. If that's a reconsideration denial, which is the next level, it'll say notice of reconsideration. And then if that gets denied, then you go to a hearing. That's where you request a hearing. All of these can be done online. You can also do them over the phone with Social Security, although it may take a while to get an appointment because they are short-staffed. And of course, there are attorneys that will help. When I worked for the attorneys, we would help people by filing their applications or their appeals for them. The main thing is to fill in as much information as possible, be honest, and list all your health conditions, because they're going to look at you as a whole person with every condition that you say you have. If you're diabetic and you have neuropathy in both feet, that is a listing that they're going to look at to see if there's any type of work you can do when they're determining disability. If your kidneys are failing and you're on dialysis, they need to know that, what type of dialysis, where you go for dialysis. That's a big one. A lot of folks can get approved for. It's still a little tricky the way the listing is written, but if you're on dialysis, that's something they definitely need to know. If your eyes have gone bad over time from diabetes, then that's something important they need to know about. Heart problems. If you have heart problems or breathing problems, make sure you put down what the diagnosis is, what doctor you saw for it, and any limitations it's put on you as far as you're doing your everyday activities. Those are the things they're going to focus on. And I know sometimes it's hard to admit what you can't do, but if you focus on what you can't do when you're doing your application with them or you're doing an appeal with them, that's going to help them understand why you can't work. And the initial and the appeals are pretty much the same type of forms. When you fill them out, obviously on the appeal, you don't need to put down the same information from the initial application, but you will want to put down that your condition has gotten worse, because if you say it's the same, a lot of times on reconsideration, which is the first level of appeal, they'll go, oh, well, there's no change, so we're just going to affirm the first denial. So even if you just have to say you're having more trouble sleeping, or maybe you have a new doctor, just some kind of new information that you can use with Social Security to get them to look at your file and not just do a rubber stamp denial. I'm sure there's a lot more. If there's other questions that you all have specifically, keep in mind it's going to depend on your age, your past education, your past work history, and what kind of limitations you have from your current medical conditions as far as determining disability. So it's not a simple thing. It's complicated. But if you have some general questions or things you'd like me to address in a future video about this, just let me know in the comments, and I'll do a video. Thank you so much for watching. I appreciate you coming by. Hope everybody has a wonderful day. Bye.